successful. So her shoulder height is usually right around that of the crease. I'm actually going to bring you down just a little bit. Perfect. Yep. Mm-hmm. Okay. I oftentimes will scooch them just enough over towards me that I can reach, and that depends on the. Yeah, that's going to go. I think that's going to go pretty well. So, table height. I don't know. You could do it like knee, like I'd say lateral femoral condyle, maybe a little bit above. I think it's classically described within the book, and the instruction is like almost like the bottom third of my thigh, enough so that I can kind of get up and get over her. The tension. So it's not every patient that can lie in this like prone position with cervical rotation. So that also is one of the reasons why they have the seated techniques as well. But Mallory's doing pretty well. In fact, she probably has a lot of mobility here. So we may have to take up the tissue slack such that we can be successful. So I'm gonna traction her down, and you can kind of see in her shirt that we create some tension lines within her shirt. We're also creating some tension lines within her tissues. Then the hand goes at the top of the table, and then we have them like look at their hand. Okay, so it's going to be a lateral break. So it's going to be this, and then we spoke about that 91.4% of the time it's going to be the cavitation is going to occur on the contralateral side of my short applicator. That's important for me because that's where I'm expecting this to gap. This technique is also necessary. You're going to start them in rotation, but when you actually perform it, she's going to be very close to neutral. So you're going to use your short applicator to rock them towards you. As such, their head's going to go like this. Once their nose is facing the table, that's where you thrust 60%, 40% effort, and they work together. So I'm going to start wide, and then I'm going to come over from the AC joint down to T3. So you can go right at C2 or C1, but you risk like manipulating higher up in the cervical spine.
I don't have an answer for that. Oh. Is there something?
You're good. Yeah, so you risk getting it higher up, which you can get pretty good cavitations, but you also risk just tractioning the plexus on that side, which is like dead uncomfortable. So I'm gonna have you reposition yourself now that we got that watch out of the way. So good. So that one's all right. That. Traction down the other side. Okay. And then what you can do is you can stack the pillow. Sometimes they need like two. I'm going to give it a little bit of a breathing. Let's do this. Lift up. Something like that. Okay. And so I'm going to, as I was talking about, you're going to start at AC joint. I'm going to come over such that I'm getting this. And then it's going to be this lateral break. Are you okay with that?
Mm-hmm.
Yeah. All right. I don't like as much extension. And then I am going to have her scooch over just a little bit more towards me. All right. So this is one, because you're already sensitive of your patient being prone, you're sensitive of their comfort, where people tend to be like, are you okay? Are you all right? Are you all right? And like, you just like kind of smash their nose and they're like, yes, I'm fine. Right. But like you want to kind of get in there, there are some moving parts because you're really trying to get that comfort, and then as soon as their nose is down after a couple of mobilizations and you're trying to feel out that barrier, then you do your 40-60% thrust. All right, we'll go into it now. So start at AC joint, I come across, come in, it's like that. Okay, so a couple things that can go poorly with this is if I don't start at the AC joint and I come high, I'm on her rib, and she's like, that sucks, right? I need to stay low and I need to stay off that. You can still take her upper trap and like provide that, which provides a little bit of buffer, but if I come in like that on her scaling, she's not going to thank you and she's not going to come back. Okay. Was that okay, Mallory?
Yeah, no, that was
Okay.
good.
Any questions on that one?